speaker, Dr. Emma Erickson. Dr. Erickson is a healthcare provider at Alomere Health, Minnesota. She meets people where they're at to take care of the whole family, from newborns to adolescents to well adults to managing the end of life. She loves getting to know her patients and works to impact health disparities in our community. Please welcome Dr. Emma Erickson.
Hello. um, Thank you for inviting me to talk to you guys today. I'm very excited about it. I wish I could see everyone in person, but this will do. I'm Emma Erickson. I'm a family physician at Alexandria Clinic. A little bit of background, I've been at Alexandria Clinic since August, and so just a few months here. And prior to that, I was in my residency training in the West Metro area of the Twin Cities. And I, when I got asked to speak today, it made me reflect a lot on my residency training, which was a little bit more hands-on with end-of-life care, because I worked a lot more in the hospital setting, in the inpatient setting, and part of my responsibility as a resident physician was to be on call in the hospital, and with that role, I would be paged for each death that occurred in the hospital, and participate in declaring deaths in the hospital. And so with that experience, over 3 years of residency, I saw a lot of various end of life care, and a lot of different ways people died. And sometimes it was beautiful and peaceful, and sometimes it was chaotic and unexpected. I can think of a few experiences that kind of stuck out to me during my residency training. I did take care of a patient for a couple of years who did not have any wishes known to her family, or any advance directive filled out, and experienced an unexpected and irreparable brain injury, and ended up living for a couple of years actually on respiratory support, which was a very difficult situation. But I do think of one really impressionable patient that I took care of in residency, who had an unexpected health event that ended up being fatal, but experienced brain death, and had decided to be an organ donor, and had pretty specific wishes for how he wanted the end of his life to be, whether it was expected or not. And what happened in that situation was I had to be in the operating room with the family as they said their goodbyes, and we withdrew life support. And as he died, and when he finally died, I pronounced his death, and then the family left, and the surgical team came in to perform the last operation for his organs to be donated to someone in need. And what was so, I mean, it was a monumental experience in general, but was so beautiful about that experience was that they actually had a dying playlist that they played over the speakers in the operating room. And I can remember each and every song that played, and how unique that situation was, in that experience with death was, because he was surrounded by his family members and had this beautiful music playing, and it was one of those moments that feels like it goes very quickly, but also feels like it's been, a couple hours in the room when it's only been a few minutes, and just caused me to reflect for a long time after that experience too on, you know, what I would like that situation to look like should I ever be in an, you know, unexpected health crisis like that. And I remember during medical school too, we actually were requested to fill out our own advanced directive. And so I think that I've had one since I was 22 or 23 years old. And so, you know, taking all of my inpatient and hospital experience and translating it to my outpatient clinic practice now, it looks a lot different because I'm not around people that are actively dying or doing those death pronouncements anymore. And now get to kind of be on the front end of things and have those conversations about having an advanced directive in place for those situations down the road. And I actually, I mean, just this morning I had 2 appointments where I handed out advanced directives and kind of talked about the importance. And I think about a couple of patients that I've talked to in the clinic in the past few months who hadn't had one in place, but filled it out that day and notarized it and scanned it into their chart, or had one in place. And we talked about what's in her advanced directive for a few minutes during her physical appointment. And for this particular patient I'm thinking of, she actually made sure she was very specific with her advanced directive on having one of her best friends as her proxy instead of any of her 4 children, because she didn't want them to carry the burden of making decisions at the end of her life. Which is, I mean, something that if she hadn't had a healthcare directive filled out, then that would be their responsibility and be something that they'd have to deal with on top of the loss of their mother or the decline in her health. And so, you know, thinking of it that way and thinking of, you know, being as specific as possible on how you want the end of your life to look like and who you want to be making those decisions is something that's kind of unpleasant to think about and have those discussions in the moment for a lot of people. But having had my experience in the hospital, it's just absolutely invaluable to have those conversations early and to make those arrangements ahead of time. And the biggest thing that I like to talk to my patients about too is that this is more than just you know, CPR, opting for CPR versus DNR. And is a lot more about, you know, exactly how you want the end of your life to look like. And if you want a dying playlist, if you don't pass unexpectedly and have, you know, support withdrawn, and who you want at your bedside and who you want to make those decisions and exactly how you want the end of your life to look. And it's never too early to talk about that and to have those arrangements made. And so, and I guess the last thing to mention too is that I do have a lot of patients who have advanced directives on file from 2002, 2003, 1999. And so the importance of revisiting those advanced directives and making sure that that we don't have to make any changes or fill out a new one, and not just initiating an advanced directive, but maybe revisiting it too during appointments is very important too. So very excited about National Healthcare Decisions Day and thankful that I got to be a part of this program.